COVID-19 no longer means 5 days in isolation. CDC. COVID-19 no longer means 5 days in isolation, CDC says. So we were right all along. What was the last 3-4 years? 5 years. It's been almost 5 years. Lockdowns, curfews, businesses shut down, people arrested, riots occurred, lies happened. Americans who test positive for COVID-19 no longer need to stay in isolation for 5 days, U.S. health officials announced Friday. The Centers for Disease Control and Prevention changed its long-standing guidance, saying that people can return to work or regular activity regular activities if their symptoms are mild and improving, and it's been a day since they've had a fever. A day. The change comes at a time when COVID-19 is no longer the public health menace it once was. It dropped from being the nation's third leading cause of death early in the pandemic to 10th last year. I don't even think that it was the third. I think they fudged the numbers and they added in a lot of deaths, and they caused a lot of deaths that made that number go way up. Most people have some degree of immunity to the coronavirus from vaccinations or from infections. And many people are not following the 5-day isolation guidance anyway, some experts say. I never did. Most people that I know never did. We had we had stuff in place in like the stores. But nobody really followed it. And if people had masks on, they would just, had it over their mouths or like on their chin. Somebody would say something and they'd be like, ah. I mean, obviously there was a lot of people who just complied with no questions asked. They were like, oh, they say that we got to do it, so we got to do it. Our goal here is to continue to protect those at risk for severe illness while also reassuring folks these recommendations are simple, clear, easy to understand, and can be followed, said Mr. Mandy Cohen, the CDC's director. Well, they weren't recommendations before. Now they are recommendations. Before, they were straight up mandations. They mandated lockdowns. They mandated that we not be able to go to work and go to school for 2 weeks. Now it's reduced down to a day. However, some experts worry that the change may increase the risk of infection for older people and others who are more vulnerable to getting seriously ill. Why are the guidelines changing? COVID-19 is not causing as many hospitalizations and deaths as it did in the first years of the pandemic. The change, I think a lot of it is just people aren't going to the hospital because they've realized, oh, it's not that bad. The change is an effort to streamline recommendations so they are similar to long-standing recommendations for flu and other respiratory viruses. Many people with a runny nose, cough, or other symptoms, wow, I can't read today, aren't testing to distinguish whether it's COVID-19, flu, or something else, officials say. It may not be as stringent, but the guidance emphasizes that all people with respiratory symptoms should stay home while they are sick, said Dr. David Margolius, the head of Cleveland's health department. The guidance emphasizes not government mandates, which we all know that if they want you to be arrested, you'll be arrested anyway. It doesn't really matter what you do. What has changed is how much COVID is harming us as a population, Nuzzo said. Officials noted that some other countries in California and Oregon have eased isolation guidance in a manner similar to CDC's latest change and did not see an increase in cases. What are the new guidelines? If you have symptoms, stay home until your symptoms are mild and improving, and it's been a day since you've had a fever. But then you can remain cautious by wearing a mask and keeping a distance from others. I still don't think wearing a mask literally does anything. There's no evidence for it. Oh, what about all of these studies? There are studies on both sides that have evidence for both, and they have shitty people involved on both sides. They have bad information on both sides, so I'm just gonna do what I want, which is just stay away from people in general, like I was already doing. And if I'm sick, I'm just not going out, because who wants to go out when they're sick? I mean, I might go to the store and get something real quick from the store, but oh well, it is what it is. However, the CDC guidance for workers at nursing homes and other healthcare facilities is staying the same. That makes sense. That includes a recommendation that medical personnel stay home at least 7 days after symptoms first appear, and that they test negative within 2 days of returning to work. The agency is emphasizing that everyone should still try to prevent infections in the first place by getting vaccinated. No thank you. Not going to be doing that. Washing their hands and taking steps to bring in more outdoor fresh air. Is there opposition to this change? Yes, and even some who understand the rationale for the change have concerns. My biggest worry in all of this is that employers will take this change in guidance to require employees to come back to work before they are ready to, before they feel well enough. Get it over it. You don't like it, find something else to do. And before they are not likely to pose harm to their coworkers, Nuzzo said. COVID-19 remains especially dangerous to older people and those with other medical conditions. There are still more than 20,000 hospitalizations and more than 2,000 deaths each week due to the coronavirus, according to the CDC. I just read somewhere else that it was 15,000 per day still. And it was 1,200 ICU visits. This week, the CDC said seniors should get another dose of the updated COVID-19 vaccine. Will schools change their rules? Not necessarily. Schools and child care providers have a mixed record on following CDC recommendations and often look to local authorities for the ultimate word. And sometimes other goals, such as reducing absences, can influence a state or district's decisions. I'm really having troubles today. When California eased its guidance, it encouraged kids to come to school when mildly sick. It also said students who test positive for COVID-19 but don't have any symptoms can attend school. Here's an idea too. Let them go to school anyway, but isolate people. Use screens. I don't know. I think kids, even if there was like a deadly pandemic, should be actually going somewhere to go to school, not just being at home. I also don't think that public schools are good, and I think that you should school at home anyway, but if public school is what you're basing your whole entire life on, that would be the way to do it. But I suggest you just straight up do homeschooling. Is this the first change for isolation guidelines? No, the CDC originally advised 10 days of isolation, but in late 2021 cut it to 5 days for Americans who catch the coronavirus and have no symptoms or only brief illnesses. Under that guidance for the general public, isolation only ended if a person had been fever-free for at least 24 hours without the use of fever-reducing medications and if other symptoms were resolving. AP education writer Bianca Vazquez, I hate last names, in Boston contributed to this report. The Associated Press Health and Science Department received support from the Howard Hughes Medical Institute's Science and Educational Media Group. The AP is solely responsible for all the content. And there you go. It wasn't a very informative article. It kind of was just like, hey, they reduced their restrictions. They didn't really say why, other than we have lower cases, but I think the cases were fudged in the first place, so I don't know, man. Seems like we did a whole bunch of locking us down and taking control of us for nothing. And it feels bad. It feels bad, man. And they're still trying to push vaccinations, even though obviously they don't fucking work. if people are still getting COVID and still spreading it. I know people who took the vaccine and had COVID worse both times that they had it than the both times that I had it. So what's the point? I don't get it. If you like what I do here, I got stuff down there in the description. Join the Discord. If you don't want to do that, just like the video. And get out of my house.